guys, it's the Hazy Max. I thought I'd do a little update after my video about 2 weeks ago where I was really down, and just let you guys know what was going on. So I actually had a few of my family contact me after watching the video saying like they were really concerned about me. Was I gonna do something stupid? You know, am I depressed? Well, to put you at ease, I'm not gonna do anything stupid. You know, I'm not about to top myself or throw myself off any buildings. I'm fine. On Monday night, I actually I was teaching a fitness class and I got pain in my chest and a shooting pain all up my arm, and I sort of thought I might be having a heart attack. It really panicked me. So I phoned like the NHS consultant people. It's like a phone line that lets you go through, they ask you questions about how you're feeling and diagnose whether or not you need an ambulance or to go to hospital or just to see a doctor. And they actually said that I needed an ambulance to be called out in the middle of the road where I was driving home. So I spent Monday night in the back of an ambulance in hospital having lots of tests done, trying to figure out what was wrong with me, where this chest pain came from. And long story short, basically my vitamin D levels are insanely low. So a normal person's vitamin D is anywhere between 75 and 200. I'm not sure of what the measurement is, but they're the numbers. My vitamin D is only 30. So really low if you think that 200 can still be healthy, and I was only on the 30 region. So anyway, the side effects of low vitamin D are depression, low mood, lack of energy, feeling dizzy, feeling weak, pain in your chest, muscle spasms, you name it. Basically everything that I had that Monday night and everything that I've been feeling for the last 3 months, if not a little bit longer. Yes, there have been, you know, some heartbreak that's played a part in that. I do still live at home. I am still, you know, down in the dumps about lots of things, but probably the low level of vitamin D in my body is making it very hard for me to try and be optimistic about things even when good things are coming up. So I'm on some really high dosage vitamin D tablets now for the next fortnight to try and get those levels back up to normal, and then I'm going to be on a vitamin D supplement once a week to maintain those levels, because vitamin D is what you would normally get from sunlight. And it's actually really important. It helps your body absorb calcium, it helps you keep your energy up, it helps your muscles actually stay working. So it's no wonder that I feel like absolute crap if I have none of this in my body. So hopefully within a couple of weeks I will start to pick up a little bit and feel a little bit better. My doctor has also recommended that I start seeing a counsellor again, which I used to see at the real start of my weight loss journey. Before I had the surgery, I saw a counsellor for about 6 months, and it really did help in my understanding my behaviour and my patterns with food and with addiction and self-confidence and all that. So I'm actually quite looking forward to the idea of having one of those again and seeing someone to be able to talk stuff through with. And when I was looking into this, I sort of, back in the day before I did my fitness qualifications, I always thought, you know, maybe I would like to be a counsellor for people with eating disorders, with problems with food addiction, with all that sort of thing. But when I looked into it, it was like, it's like 4 years at university, you know, that's £8,000 a year in this country, or it's like a 6-year course if you do it outside of university, which seemed a really long time and a real huge expense to invest in something. But now thinking about it, and with my career in fitness and how I think, you know, I want to progress as I get older. You know, when I'm 50, do I still want to be teaching insanity classes and jumping around at high impact? No, not really. I still want to be keeping fit, but I'm probably going to want to bring it down a little bit then. And I thought, actually, you know, going into counselling and investing 6 years of my life into studying about behaviour and behavioural patterns would actually probably really benefit me as well as the clients that I would have further down the line. So I'm actually going to start inquiring about starting my level 1 counselling course in September. So it would take me at least 6 years to be a qualified counsellor, but when I was qualified, I would then be able to counsel people in eating disorders, in self-confidence, in cognitive behavioural therapy, which is what I had done to control my binge eating disorder. And it would play a huge part in helping people before weight loss surgery, after weight loss surgery, anyone with any sort of issue with food or addiction, whether it's like alcohol or drugs, it would probably really open up a lot of doors for me and tie in really nicely with the food and the fitness qualifications that I already have. So this is giving me something to focus on and possibly keep me going over the next 6 years, which is a long time of my life. But I'm just going to focus on doing level 1 to start with and seeing whether or not I like it. I don't have to commit to, you know, it being a career down the line, but if I do my level 1 and see whether it helped me and whether it interests me, and whether I could see myself doing something like that, at least, you know, that is a step in the right direction. And I'm pretty sure that it will benefit me as well, because obviously I would learn all the techniques that I used to do as a patient and the, you know, the logic behind them and the understanding of them. So I'm quite looking forward to, you know, getting into that a little bit more. I did say on my last video that I was contemplating maybe doing some fitness videos and some recipe videos. So that is something that I am going to start doing on a regular basis. I'm going to try and post one maybe once a week at the weekends. Some sort of like, you know, like 20-minute workout, 10-minute workout of, I'll start from beginner's level that anyone can do at home, no equipment or minimal equipment, and hopefully get some of you guys moving a little bit more, because I know that people struggle. Not everyone wants to go to the gym. I don't always like going to the gym. People like to do something at home that takes, you know, hardly any effort. They just throw their gym clothes on, work out in the living room for 20 minutes, straight in the shower, and you know, you are done for the day. You know, that is personally how I prefer to work out. I started with Jillian Michaels DVDs, and they are 20 minutes long and you are done, and that was the perfect way for me to start working out. So I'm going to look into doing some of those soon and hopefully try and post more regular videos, because I feel like the further I distance myself from the weight loss community, the more I lose myself. And I know that, you know, my surgery was only a part of my journey, but when I try to forget that part and just feel like a normal person, a normal personal trainer or someone in the industry that I'm in now, I feel like a lost sheep. Like that's not actually who I am. You know, I've come from this background and I need to embrace that background and focus on that background, and that keeps me going. You know, it reminds me of where I've come from, and even though I'm not perfect now, when I focus on, you know, that background and how far I have come, it makes me feel better, because I know that, you know, I'm still miles better than I was. You know, it's 4 years down the line and maybe I have a stone on of 7 stone that I lost. You know, that is a great achievement. I still exercise at least 5 days a week. I'm eating better, even if I'm eating junk sometimes. You know, I've still progressed a long way. I'm by no means perfect, but by remembering that journey, it keeps me focused, it keeps me on track, you know, and reminds me who I am. So yeah, ultimately I am feeling a little bit better. I'm nowhere near, you know, right, and I still feel down, but I know what to do now, I think, to try and bring myself back up. So I'm optimistic that I can probably, you know, cheer myself up and set myself some goals to achieve in the next year or so, and give me something to focus on rather than constantly being obsessed with the fact that I live at home, I'm still single and I'm miserable and broke. You know, what does it matter if I have no money? If I'm helping other people, I'm helping other people achieve their goals, I'm still achieving mine, and you know, I'm ultimately happy in myself. That should be my goal, to be happy with me, before I'm, you know, focusing on something else. So yeah, so thank you for all the kind comments at the end of the last video. I really did appreciate them. It helped me to know that, you know, if I do need to break down and have a little cry, that you guys are all there to pick me up. And the comments that I got were really, really lovely. So thank you to everyone that commented on that video, and I promise that I will check in soon.